Hi, my name is Dr. Roger Tsai, and I'm a board-certified plastic surgeon in Beverly Hills, California. Today, we're going to go over the consultation process for a BBL or a Brazilian butt lift, which is a kind of slang term for what we call gluteal fat grafting or fat transfer to the butt. We'll go over the surgery, the recovery process, expectations, and timelines to expect for this type of procedure. So a BBL, I generally like to talk about it as a 2-in-1 procedure. The first part is liposuction and body sculpting to remove all the excessive fat from the body. Most patients undergo what we call a lipo 360, which includes the stomach, the flanks, the upper and lower back. So the reason we call it 360 is basically it goes all the way around the body from basically the neck to the pelvic region. Some patients, however, would like to add their thighs and their arms as additional areas of fat. This first part of the procedure with liposuction comes body contouring. So the fat is removed strategically and in a certain fashion in order to shape and contour the body for an improved appearance. The second part of the procedure is actually transferring and injecting that fat that was taken out from the first part of the procedure into the buttock. Now, some patients want the hip dips filled, some patients want more projection, some patients want both. Some patients also want the upper part filled, some patients want the bottom part filled. So this is customized for each particular patient. So with the liposuction and the fat transfer together, patients will oftentimes get a more hourglass shaped appearance as the body and the waist comes in and the buttock comes out to give you that shape. So with the liposuction and the fat transfer combined, what you end up getting is a more streamlined and contoured body, as well as fullness into the hip and the buttock region to provide an hourglass shape and appearance. The great thing about this procedure is there's no large scars or incisions. There are tiny little poke holes for a cannula to go in to remove the fat, and a tiny little poke hole for the cannula to go in to inject the fat as well. Because of this, the recovery for this type of procedure is fairly quick, which we'll talk about in a second. Additionally, those patients who are looking for ab etching, this can be also performed at the same time. So this procedure is done fully asleep under what we call general anesthesia. Because of the medications given under general anesthesia, sometimes it takes patients about 2 or 3 days to feel back to normal again. I feel like it's almost like a lazy weekend where most patients are somewhat home-ridden and kind of walking around the house a little bit, but also getting up to use the bathroom, to eat, and to move around just a little bit. As mentioned before, because there's no large incisions or muscle being tied together or cut or released, the recovery is fairly quick. Patients are usually back to work and doing all their normal daily routine and activities within the first week. The only concern with this procedure is that we do not want to place a lot of pressure to the buttock region. So I generally don't have my patient sitting on the buttock directly for about 1 month. That's not to say you couldn't sit on it. As long as you use a BBL pillow, which we will talk to you about getting, you can sit on the buttock. So the BBL pillow is basically a big, almost yoga platform with 2 troughs for the upper thighs. So when you're sitting, you're putting pressure on the upper thighs, not the butt itself. But you can stand up as much as you want, and you can lay down as much as you want, as long as you're laying chest down. Again, this was only for about 1 month. After 1 month, you can sit on the butt as much as you want. Additionally, patients will be required to wear a compression garment, which we will provide to each patient. I recommend patients wearing the compression garment basically 23, 24 hours a day, as much as you can during that first month. And then month 2, 3, and 4, half and half, either all day or all night. Another aspect of this procedure is making sure each patient wears a compression garment. A compression garment will be provided to you for the patients to wear during your recovery period. So I always recommend patients wearing their compression garment basically as much as they can during that first month, basically 23, 24 hours a day if you can. You can take it off to shower, you can take it off for hygiene, but other than that, please wear your garment. Now, month 2, 3, and 4, I have patients wear it half and half, either all day or all night. The reason the compression garment is very important is because that's what helps shape the liposuction area. The way I like to think about it is, imagine a sponge. It's almost the same thing. There's a bunch of little holes in there. When you squeeze a sponge and it dries up, it's nice and tight. Just as if the body heals, it'll be nice and tight. And if the sponge dries up wide, it's not going to get that same contour. Same thing as the body. If you're not crunching down all those empty spaces, you might not get that quite tight, snatched contour that most patients are looking for. So it's very, very important and imperative that patients are wearing their compression garments as recommended. So with this type of procedure, a lot of the results are due to patient care and recovery afterwards. So when it comes to lymphatic drainage, I think it can help in the short term if you have an activity you have to attend or an event you have to attend shortly, or if you're an actor and actress, which a lot of my patients are, and they have to get on the sets quickly, then yes, the lymphatic drainage can help. But in the long term, I think as long as you wear your compression garments, it's not 100% necessary. So when it comes to lymphatic drainage, I leave that up to the patient. Lastly, do understand that fat transfer is very unpredictable. Okay, the reason for this is that about 20 to 40% of the fat can die off. So it might look a certain way after the procedure, and then maybe 1 or 2 months later, it might shrink down. This is because the fat cells don't all survive. Think about it like a transplant. We're transplanting billions and millions of cells over. Each one of these cells need nutrients, oxygen, to live and survive. Not all of them are unfortunately going to live, and a lot of them will metabolize and die off. So unfortunately, about 20 to 40% of the fat will go away, and so therefore the results are oftentimes unpredictable as far as size goes. However, the great thing is, once it's settled, it's permanent and will last you forever. The thing is, if you do gain weight, do understand that the butt will get bigger, and if you do lose weight, the butt will also get smaller. It is very dynamic with the body changes. So this is just generalized information for a BBL procedure. Obviously, this procedure is customized to each patient's desires and goals, which is why the consultation process is important, so that we can review what each patient would like and the results that we can obtain for each individual patient. Comment below if you have any questions, or feel free to reach out to our office if you're looking for a consultation. Hope this was educational and informative to you guys, and follow us for more content.